I'm Dr. Devendra Venkatramani, and I'm very happy to be joined today by distinguished faculty and doctors from around the world. And the first talk for this session is on the FRCS examinations, and we'll just dive straight into that. So the Royal Colleges are quite a few actually, but I think for most ophthalmologists, these are the three important ones. That is the Royal College of Surgeons of Edinburgh, the Royal College of Physicians and Surgeons of Glasgow, and the Royal College of Ophthalmologists. For this talk, I'll be focusing on the first two, essentially the Royal College in Glasgow. And you can see over here the dates of, the dates that the charter was drawn up. So they're really very old colleges with a lot of ancient history that comes along with them. It was established in 1599, and these are some of the images from Glasgow when I had gone there for my convocation after successfully clearing all parts. And just as a side note, that's a fried Mars bar. Glasgow is famous for its deep fried foods, and no wonder it's the heart attack capital of Europe. So these are some of the images of the convocation ceremony. I'd gone there with my dear friend, Dr. Asif Virani, who had given the exam along with me. And, just to stress the importance of someone you can study with and someone who can, help you through that process. It's always useful to have a study buddy for this examination. It's a very glittering ceremony with a lot of pomp, so you can always look forward to enjoying that once you've gone through this arduous process. So the examination itself is divided into three parts. The first part is a MCQ examination, MCQ test with 160 questions, and is done for 2 hours. And you have almost equal division between these topics of anatomy, physiology, pathology, and optics is also a part of this examination. Part 2 has been changed from very recently, so it's not how I gave the examination, but now Part 2 is a single examination. That's an MCQ test. 180 questions and 2.5 hours to solve them in. And the broad topic is ophthalmic medicine and surgery and general medicine, the management of acute medical emergencies and neurology with particular reference to ophthalmology. And this is the breakup of how the weightage of questions will be. And just to draw your attention to the fact that general medicine and medical emergencies accounts for 8% and 3% of the questions respectively. So this has replaced the theory or essay writing component of Part 2. So now Part 2 is a single examination. There are no multiple parts or sub-parts of Part 2. Part 3 has remained the way it was. It comprises of 2 parts, the structured oral examination, which is also called the OSCEs, and there are 3 table vivas that are conducted in this examination. The first station is lids, oculoplastics, and anterior segment. The second is posterior segment, which also includes glaucoma. And the third is neurology, motility, and general medicine. And then you subsequently, on another day, appear for the clinical examination, which has 4 stations. And the 4 stations are anterior segment, posterior segment, neuro-ophthalmic and ocular motility disorders, and oculoplastic and lid disorders. So unlike Indian examinations where we could afford to leave for option various topics in neuro-ophthalmology and oculoplasty, you cannot really do that in this examination because you have to pass in each of these stations to clear the examination. Now there is an option of getting a degree called the MRCS Ophthalmology from Glasgow, which is available if you have completed the Part 2. Essentially, after Part 1 and Part 2, you can avail of this degree, which is the MRCS. So who's eligible? So for Part 1, you need a minimum of 2 years post-qualification experience, including your internship of 1 year. For Part 2, it has to be 6 years, which includes your 1-year internship, and 4.5 years of that post-qualification training has to be in ophthalmology. So you may have done a post, or you may have done some few months in a different specialty. That's okay. You can show that certification as part of your eligibility. And essentially, Part 3 can be applied for if you've completed both Part 1 and 2. Now, these fees are a little outdated. The simple reason is that since COVID, there have been a lot of changes in the fee structures. So this is essentially about 1.5 years old. but you can see that it already runs up into lakhs of rupees if you do the conversion. So it is something that one has to be really mentally prepared for, because there's no point in entering the stream and then finding it to be too expensive to complete. So have that thing in mind before starting. At the same time, bear in mind that there's a 5% to 10% increase every year. So by the time you give the part 3, which may be 3 or 4 years down the line, the fees would be quite different than this. So it is really something to spend a lot of time to think about. Again, the website says that there's a maximum of 6 attempts for each part, and of course you have to pay the full fee for each attempt. So I don't think anybody's going to attempt the examination a 6th time. You'll be quite old and infirm by the time you reach that. So try not to think too much about the attempts and try to clear it in the first shot. All of these and other details will be available to you on this website, which is the official website of the Royal College. So you can really go into all the nitty-gritty over there. And of course, apply online for the examination. Now, the Edinburgh College had this sort of flirtatious relationship with the ICO. For some almost 3 years, they, in a sense, outsourced their examinations to the ICO and stopped conducting the examinations themselves. But now they've separated, and since June 2021, now they're restarting, I should say, their examinations for the MRCS and FRCS. However, if you have completed ICO examinations between these dates, you will be eligible for the appropriate, recognition from the Royal College of Surgeons of Edinburgh. So unfortunately, the website, which is rcsed.ac.uk, does not yet talk about the examination fees, examination dates. I think all of these are still to be confirmed and to be decided. So we'll have to wait patiently for them for further clarity on that. So in general, the examination technique is something called the modified Angoff technique, where you are not really, there's no pass mark. Whereas in Indian exams, you have a 50% score allows you to pass the examination. Here it's not that. Here the pass mark is variable, fluctuates depending upon the difficulty level of the examination, which is assessed by the examiners or the paper setters. So you may, you have to clear whatever the pass mark is. In a sense, the pass mark is higher if the examination is deemed easy, and it's low if the examination is deemed to be difficult. So how do you really prepare for this and in general other examinations? For the optics section, I would strongly recommend reading the textbooks by Elkington and Dr. A.K. Khurana's textbook of optics and refraction, really quite comprehensive and very well laid out. For basic sciences, indispensable is the MCQ book by John Ferris, which also gives you explanations for why a particular answer is correct and why the other answers are wrong. And if you really want to go into depth, there is of course, the tome, which is the textbook by John Forrester, who incidentally was awarded the honorary FRCS at the same convocation that I happened to attend. For the part 2, whatever your postgraduate syllabus is, the MS or DNB syllabus is definitely adequate, but you may want to brush up on the MCQ aspect of it by using this book by Jeffrey Lampkin and other authors, the Massachusetts Eye and Ear Infirmary Review Manual. And this is the ideal book for reading up on emergency medicines. That's the Oxford Handbook of Clinical Medicines. There's a segment at the end which talks only about clinical emergencies and how to deal with them, and there's a lovely flow chart approach to each of these emergencies, so it will help you when you appear for the MCQs in part 2. So a few tips. One is that, this examination is extremely practical. They're not going to ask you percentages of incidence of a particular disease or some esoteric theoretical point, but you need to really have a very methodical approach, especially in the third part when you're face-to-face with a viva, with an examiner, and sort of move from a life-threatening disorder first to a vision-threatening disorder to a cosmetic disorder. And with regard to the clinical examination and viva, they're really something that we are not trained for. The viva, which is the OSCEs, is really a very rapid-fire sort of examination, and you have these stations of 20 minutes with 2 examiners. That's 10 minutes per examiner, And they have a set pattern of questions. That is, it's a structured examination. They have specific questions that they can ask you, and the answer, the model answer has certain keywords which you need to hit so in order to score. And they won't proceed unless you are able to, either say that you don't know the answer or you answer it adequately. So many times the questions are in the form of a picture or a clinical situation, and it builds on the previous, so the subsequent question sort of builds on the previous one. In the clinical examination, where you're actually examining patients, you have all of these, stations, as I discussed earlier, but you have a very little time at each station. You have only about 12 minutes at each station and 2 examiners, and the more number of patients you can see or you can go through, the better. So I'll just say that, you need to practice this because it's not a skill that comes very naturally. And why does really anybody do FRCS examinations is because it does offer some tangible benefits in that you don't have to do the PLAB if you want to, look for a job in the UK. You can directly register with the GMC. There are obviously, better remuneration in certain countries and in certain institutions if you have these degrees. You can, if you're interested in the ICO examination, you have cross exemptions. And many people just like to see a lot of letters after their name. So whatever your motivation, I think it's a great examination to give. However, it has a few disadvantages. It's really not a licensing examination. Just on virtue of this examination, you're not qualified or licensed to practice anywhere, and they are very expensive. So think about it before you really jump in. So at Lakshmi Institute, we have this FRCS refresher course that we've suspended for the last 2 years, but we hope to restart this year. This would be our 5th time doing this course. It's a hands-on course, 2-day course with real patients. And anybody who's interested in applying for that could contact on this number and on these details. And I wish all of you the very best, those of you who are taking this journey. It's a very fruitful, rewarding journey, and I strongly recommend it. But I just wish all of you the very best and say, go for it. Thank you so much. So.